In this episode, I want to give you some insight into the healthcare that's available when you move to Mexico. I will discuss a high-level health insurance options and decisions you'll need to make about Medicare. When you get into health insurance and Medicare, there are no right decisions, but there are many, many shades of gray that you'll need to sort out for yourself. Cue the music.
Welcome to the Repurpose Your Career podcast, brought to you by Career Pivot. This podcast is where those of us in the second half of life come together to discuss how to repurpose our careers for the 21st century. Come listen to career experts give you proven strategies. Listen to people like you tell their stories on how they repurpose their careers. And finally, get your questions answered. Your host, Mark Miller, has made 6 career pivots over the last 30 years. He understands this is not about jumping out of the frying pan into a fire, but rather to create a plan where you make clear, actionable steps or pivots to a better future career. Are you ready to repurpose your career?
Welcome to episode 299 of the Repurpose Your Career podcast. My name is Mark Miller, and I'll be your host every Monday for discussion on what it's like to repurpose your career. In this episode, I want to give you some insight into the health care that is available to you when you move to Mexico. I'll discuss high-level insurance options and decisions you'll need to make about Medicare. When you get into health insurance and Medicare, there are no right decisions, but there are many, many shades of gray that you'll need to sort out for yourself. Mexico basically has 2 healthcare systems, a public and a private. This is, in many ways, is really no different than the U.S., where you have public healthcare groups run by the federal, state, or county governments, and you have private company healthcare groups. The difference is the cost. The U.S. healthcare systems are the most expensive in the world and, in my humble opinion, are quite broken. There are 2 YouTube videos I'm going to reference and include in the show notes from a gentleman called QRoo Paul from 2 expats in Mexico called Public Healthcare Options in Mexico and a look at private healthcare in Mexico. I'm not going to talk about the public healthcare system because even though it's very low cost or free, it has a lot of drawbacks. If you really want to learn more, watch QRoo Paul's YouTube video. What I'm going to talk about is the private healthcare system and the choices you'll need to make. For example, I have no health insurance here in Mexico. My wife and I pay for everything out of pocket. We do, however, pay into Medicare Part B, which we cannot use in Mexico. Wait a minute. You're probably saying, that makes no sense. You have no health insurance that you can use, but you pay into a system that you can't use. Yes, you heard me right. There are no right decisions, and there are a million shades of gray. And you have to figure out what works for you based on your physical, mental, and financial health. Before we go any further, let me mention I have a sponsor for this episode, Magicmine. Magicmine is the world's first productivity drink. It's not an energy or coffee-based drink, but a drink that will help you stay focused. I have been using the product for about a year, and it's made a real difference, but more on this later in the show. Now, let's discuss healthcare in Mexico. The first thing I want to discuss is there are 3 separate systems in the public healthcare system. I'm not going to discuss the first one because you have to be an employee. There is also IMSS and INSABI, I-N-S-A-B-I. IMSS you can buy into. Pros, it is very low cost. You may pay $400, $500, $600 a year, but they will not cover pre-existing conditions. And most of us at this age, we have pre-existing conditions. INSABI is completely free, but the level of care is less desirable. They cover what they call level 1 and level 2 treatments. If you need level 3, which is, things like open heart surgery, cancer, they don't cover that. If you're really interested, go watch QRoo Paul's video on the public healthcare system. What I really want to talk about is the private healthcare system, which, by the way, is quite reasonably priced. Prices are right up front. For the average Mexican, they're expensive. For the average expat, they're actually pretty reasonable based on your income, the amount of money you have. So this is all relative. The first kind of doctors you might find are pharmacy-based doctors. In other words, in front of almost all the pharmacies, there is a little clinic. I'm going to reference a YouTube video done by Brighton West from almost retired in Mexico about his experience using a pharmacy-based doctor to take care of his infected toe. You would go to these kind of doctors if you had a sore throat, you had an infected toe, really minor things. And typically the cost is going to be under $10 to see them, and they can give you prescriptions. Most medications, you don't need a prescription. I get a prescription from my doctor for various things, so I know exactly what to go ask for. Most medications, you just walk into the pharmacy and ask for them. Now, I will tell you, not all medications are available in Mexico. You need to check whether the medications you're on when you come down and visit, whether they are readily available. So I'll use a couple of different examples. My wife was on a thyroid replacement med that is only available in the U.S. And when I asked about it on some forums, I found about, 25, 30 people responded. By the way, all were women. And they all said we went back to the U.S. once a year and got refilled the prescription. Now, by the way, to get a 1-year prescription in the U.S., you had to bypass your insurance. But fortunately, it was, $700, $800 for the year. My wife eventually decided to switch. We have seen other situations where prescriptions are available, but you have to pay for the entire cost, which in the U.S. was usually covered by insurance. So with medications, you really need to come down, see what the cost of the actual med is. Is it available? Use the example, my wife is on a very low dose steroid, which she cannot get from a local pharmacy. We get it from a mail order pharmacy in Mexico City, and we found that pharmacy through my wife's endocrinologist. There are also private clinics, and QRoo Paul discusses this in his video, but I don't have any knowledge of them, so I'm really not going to discuss those. Let's start out with a general practitioner. I have a general practitioner. I've been paying between 400 and 600 pesos per visit, which, by the way, is $20 to $30 per visit. Yes, that's the actual cost of the visit. And usually the visit can be up to an hour. When I need lab work done, I will just simply go to the lab and pay for it. And by the way, they will send the results directly to me and my doctor via email. I've had x-rays done. I fell down and thought I'd broken my wrist, and I was able to that day be able to make an appointment with my doctor and Dr. Jessica, and my doctor is Dr. Jessica Flores, and by the way, you refer to your doctors by their first name. I went and saw her the same day. She said, go get an x-ray. She wrote up the x-ray I should have. I went down to the local hospital, walked into the x-ray lab, and they did it. And by the way, the cost was about 700 pesos or about $35. Again, 15 minutes after they had done the work, I got an email with, by the way, the diagnosis, the person who had read the x-ray and the x-rays. When you go and you get x-rays done, they're yours. The next thing is to go visit a specialist. I see a dermatologist. My wife sees a hematologist, a dermatologist, and an endocrinologist. When we first started coming down, we would pay in the order of about 700 pesos or about $35 per visit. Now it's up to about 1,000 pesos or about $50. It's very common for me to be able to make an appointment and have an appointment within a week, if not just a few days. Where we go to see our specialists, it's a couple miles away. I can hop the bus, I can drive down to it, or my wife likes to walk down there. Those are very, very reasonable, and we just pay for those out of pocket. Those are things we can afford to pay for. I think the most expensive things I've had is I've had some lab work done. And I think the last one for blood, which was a fairly full panel, I paid 2,800 pesos, which is about $140. By the way, to convert pesos to dollars, basically divide by 20. But right now it's about 20 pesos to the dollar, roughly. But let's say I have to have some minor surgery. And again, if you watch QRoo Paul's video on the private healthcare system, he gives you some examples of people who had knee surgery and a few other types of surgeries. I have a friend who needed to have prostate surgery, and he decided they were basically going to go in and clean out, basically rotor out his prostate to clean it out. And the total cost, hospital stay, anesthesiologist, the whole bit was about $2,500 US. And one of the decision was, well, do we go back to the US because he had Medicare and have that done? And the answer was no, because I figured their out-of-pocket expense would probably be double that. He was in the hospital for one day. His wife was allowed to stay in the room with him the whole time. He came home within a few days. He had a catheter in. And on a Friday, he had an appointment to go see his general practitioner to have the catheter taken out. And I drove him down to his appointment, which was about a mile away, and dropped him off, told him, when you're done, just call me. I'll come pick you up. And when I came and picked him up on that Friday morning, they didn't take the catheter out. It was still bleeding. So on Sunday morning, he's not feeling very well. It's very uncomfortable. He calls his general practitioner. Yes, he calls him and says it's very uncomfortable. And the doctor came to his house and took the catheter out. Yes, the doctor made a house call. And on Monday, my friend emailed the doctor and said, "What do I owe you?" And the doctor responded with a smiley face. Basically nothing. This is all part of how they do business. And by the way, he had to pay the surgeon in cash. We'll talk about some other things. Sometimes you can pay with credit card. A lot of times they want in cash. It's always making sure that one of the key things, I'll use the example. My wife needed to go in for an endoscopy and a colonoscopy. Pretty basic stuff. So when she made the appointment to have the procedure done, they gave her a price list. They gave her the cost of the hospital, the anesthesiologist, and the gastroenterologist, and there was a cost per biopsy. The interesting one is when we went to the hospital, we immediately paid the hospital bill, which was, $100. Then she got checked in. She went and had the procedure done. When done, the gastroenterologist came out and talked to me. He gave me a full report with all the pictures. He actually gave me a DVD with all the pictures on it, which is interesting because I don't have anything that really reads it. Basically, they gave me all the information, and we paid the gastroenterologist bill and the anesthesiologist bill. I think the anesthesiologist bill was 3,000 pesos, about $150. And the gastroenterologist bill was 5,000 pesos, or about $250. Very straightforward. You will see in QRoo Paul's video, he talks about going to the emergency room. And one of the things, if you go to an emergency room, and by the way, my wife had problems one Sunday morning. She was puking up, and she ends up talking to her hematologist because she was puking up some blood, and the hematologist told her to go to the emergency room just to have herself checked out. And we entered. Now, very often what they'll do is they'll bring you in, they'll evaluate you, and then you can ask, hey, what's the cost? They will, and QRoo Paul talks about this in his video. I think he fell down, had some stitches in his head, and I think the total cost was about $60. My wife spent all afternoon in the emergency room. The doctor was never very far away. I think the cost was about $160 US, which I was able to pay on a credit card. By the way, I pay all of my specialists and my general practitioner in cash. What you see is most things are pretty affordable, but what's affordable to me may not be affordable to you. Magicmine, which I said in the introduction, is the world's first productivity drink. I only accept sponsors for this podcast where I've used their products. I'm enthusiastic about the products. Well, I've been using Magicmine for about a year. I drink Magicmine with my morning coffee, and I actually like the taste and sip on the product while drinking my morning coffee. I first used the product on our 3-day drive from our home outside of Guadalajara, Mexico, to Austin, Texas. This is a 1,000-mile drive that we've made over a dozen times. I found myself more alert and focused. Currently using as we start our annual content audit and planning for the next year for Career Pivot. I will tell you there is close to 1,000 pieces of blog posts and podcasts, and I found Magicmine invaluable helping me stay focused. I'm spending a lot of time strategizing how to grow this podcast, and Magicmine has helped me with my own creative thinking. Magicmine is a productivity drink. It's not an energy or coffee-based drink, but a drink that will help you stay focused on what you are doing and beat procrastination and get you into a working flow state. As I said, I drink this with my morning coffee, and after 30 minutes, I'm ready to go to work. If I continue to use it on a daily basis after 5 or 10 days, you will notice that you'll be more productive, stop procrastination, and will get into a working flow state much easier. There are lots of ways to consume the product, including making a latte, chugging, or sipping. Magicmine works for me, and I believe it'll work for you. I have a 20% off code to share with you guys. It's RYC, which stands for Repurpose Your Career. To use it, you can go to magicmine.co. That's magicmine.co/RYC. Enter the RYC at checkout. The best part is that they have a money-back guarantee. If you get the subscription, it's 40% off. My 40% off code only lasts 10 days, so hurry up. And as always, the link and discount code will be included in the show notes. If you go back, and I'll link to these in the show notes, I've had Queen Michelle on my podcast a couple of times. Queen is a former school teacher, doesn't live on a lot of money. She lives on less than $1,000 a month. Initially, she didn't have any health insurance down here. Her insurance was a credit card. If she ever needed to go to the doctor, that's what she was going to use. And she's in her 50s. She, on the last podcast I did with her, she is now an entrepreneur. She's written some books, and she now has private health insurance. And you can buy private health insurance that's either strictly for Mexico, or you can buy worldwide insurance. Oh, by the way, if you buy worldwide insurance, there's one price to cover you in the 140 countries around the world, minus the U.S., and a price that includes with the U.S. And by the way, it's 8 to 10 times more, including the U.S. When you apply for these insurance, they will go through a bunch of reports. With my wife, when we first moved down here, we got very high deductible, $5,000 deductible insurance plans, which cost us about $1,000 a year. With my wife, they excluded all her pre-existing conditions, which are significant. It's one of these deals of where it's just like how the U.S. used to be. The younger you get the insurance, you can typically keep it If as you get older, and I think at the age of 75, most of the companies will not insure you. I'm going to encourage you, wherever you go, make sure and find an insurance broker that will help you with that. And I'm going to put some links in the show notes of a couple of different insurance agents that are available here in Ahiheek. There are a bunch of them. There are U.S. health insurance policies. If you come down, some U.S. healthcare policies will cover you in Mexico. Kinda. Medicare Advantage plans will cover you. Kinda. And some of the hospitals will take Medicare Advantage. You really need to do your homework. If you come down prior to the age of 65, I encourage you, if you are worried about getting health insurance, do it immediately and see a broker and see what the cost is. And, will this make sense for you? I have a significant amount of money in a long-term care account. I self-insure. And if something bad happens, we'll either go back to the U.S. because we're on Medicare, or I'll just pay it for it out of that amount of money. If you, again, like you've seen, something really bad happens, like my friend who had his prostate surgery, in his case, his was $2,500. I've seen people run $5,000, but these are things that in the U.S. would cost you $200,000-$300,000. And then you'd have to look at what your out-of-pocket would be. Remember what I said, I pay into Medicare Part B. I can't use it here. So why do I pay into it? Well, when I turned 65, which was a little over a year ago, I signed up for Medicare Part B. You're automatically enrolled in Medicare Part A, and Part B you have to enroll in. If you don't enroll in it, you can. That is fine. But if you ever go back to the U.S. and need health insurance, you will pay a 10% penalty for every year you didn't pay into the system. And so if at 65, you didn't sign up and you come back to the U.S. when you turn 70, you will be paying a 50% premium from that point on. And I get people who say, well, I'm never going back. Can you really say that? The average expat returns in under 5 years. So, and I see all kinds of people who right now, I've got several friends including Queen Michelle, who have been back in the U.S. taking care of elderly parents. Now, before I was on Medicare, I bought a health insurance policy from my local agent. And when I would travel back to the U.S., I would get a travel policy from the same company. And I would pay per day, and it would be somewhere between $7 and $10 a day. I would tell them the exact dates. What the other thing that people do who have, particularly the Canadians down here, who have Canadian health insurance back in Canada, and people who have Medicare, if something really bad happens, you can buy an airlift ambulance service. There's the big one down here is SkyMed, and I'll put a link in the show notes. We will probably buy SkyMed policies. They will take care of everything. One of the things you have to be concerned with is both having insurance or be able to pay for health care in Mexico, but also what happens when you travel back to the U.S. Do you need travel insurance? In my case now, I have Medicare. So what you'll notice is this is complicated. And what works for my wife and I might not work for you based on your health and your financial conditions. During the pandemic, we had a number of people who passed away, went into Guadalajara, spent several weeks in an ICU, and ended up passing away and left behind a $50,000 bill on their deathbed. Now, if a $50,000 bill is going to totally break you on your deathbed, remember, it's your final bill, depending on your spouse, then you probably need insurance. For me, I'd be If my wife went into the ICU and ran a $50,000 bill, I wouldn't be happy about it, but I could afford to pay that. Make a major dent in my retirement, but I can afford to pay that. That's the kind of stuff that this is, particularly with Medicare. We get a lot of folks say, well, I'm not going to pay into Medicare, and they don't want to pay the $170 a month for Medicare Part B. And you're wondering why they're getting so emotional. Well, some of these people are living on $1,000, $1,500 a month Social Security check. In that case, $170 a month for insurance that they really can't use, except in real emergencies, is a lot of money, and they get quite emotional about it. So hopefully that gives you a kind of background, and I'm going to put the videos, QRoo Paul's and Brighton West videos in the show notes. I'll just embed them in the show notes so you can go watch them. This is complicated. So with that, hopefully you've learned something about healthcare and health insurance when you move to Mexico. So take a moment, go to careerpivot.com, sign up for the weekly Career Pivot Insights newsletter, which is sent out every Sunday. You'll get a weekly update in this podcast, white papers, and new blog posts. I recently published my latest white paper, Ageism, the Last Acceptable Bias. While there, do not forget to check out the Career Pivot community, which can be found at careerpivot.com/community. Feel free to connect with me on LinkedIn. Look for Career Pivot on Facebook and LinkedIn. I'm still on Twitter at Career Pivot, but I am not using it anymore. Thank you for listening all the way to the end of the Repurpose Your Career podcast. You will find all the show notes at careerpivot.com/episode-299. You'll also can subscribe to the podcast on Apple Podcasts, Stitcher, Google Podcasts, Podbeam, Overcast, Spotify, Pandora, Amazon Music, and lots of other places where podcasts can be found. In fact, this podcast can be found on the Repurpose Your Career podcast channel on YouTube. Hope to see you next Monday for another episode of Repurpose Your Career podcast.